I'm going to very briefly summarize the prospective trial. So this was a randomized controlled comparison of sacubitril valsartan and valsartan in just under 600 patients with heart failure and an ejection fraction of more than 40%. And the primary endpoint was change in cognitive function. The reason we were looking at that was because there was a concern that neprilysin inhibition might lead to accumulation of amyloid beta peptides in the brain, which could cause cognitive impairment. So we also, as a secondary endpoint, used PET scanning to look at deposition of amyloid beta peptides in the brains of our patients. So all patients were followed for 3 years, and at the end of 3 years we found no difference in cognitive function. We found that there was a gradual increase in amyloid deposition, but it was no greater in the patients who got sacubitril valsartan. In fact, the trend was to less deposition in patients who got sacubitril valsartan. So in conclusion, we have, I think, removed any concern that sacubitril valsartan might cause cognitive dysfunction, and we certainly didn't see any evidence that neprilysin inhibition causes an increase in amyloid beta peptide deposition in the brain of patients with heart failure.